So my Loom crashed and I'm starting over. So again, let's begin. Chapter 16. The Loom will probably say chapter 15. That's okay. So we're going to look at evidence-based practice, using research to guide evidence-based practice and applying evidence-based practice. So your objectives and for this chapter are: number one, synthesize key components from evidence-based practice nursing and research utilization to drive the provision of quality nursing care. Number two, demonstrate proficiency in one component of evidence-based practice using the principles of the research process and evidence-based practice appraisal. So evidence-based practice is really the application of research and research utilization. So we're using the research that researchers have done, either in the hospital setting, in the lab, in academia, to see what knowledge is out there about that topic and then bring that to practice. Our best evidence that guides our practice. That's what we're going to talk about. So our definition of evidence-based practice: use confirmed evidence, decision-making, and nurse expertise to guide holistic care to provide higher quality of care, looking at problems that are currently exist in the healthcare setting in your practice and making it better. We need evidence-based practice because we need to understand what's happening at the bedside. Our Nursing Honor Society Sigma Theta Tau in 2006, and in 2010 with the Institute of Medicine IOM government report about nursing and its direction and quality of care. And the Affordable Care Act kind of drove the IOM report to say, how can we better care for our population? So the first step is, what are we doing in everyday practice? What evidence are we using? Is the evidence sound? What problems are happening in the practice setting that aren't working any longer? We need to understand the research process to be able to make changes. What's our historical background related to that best evidence? There are obstacles in this process with research utilization and analyzing evidence. How can we move that more quickly from what we call the bench or basic science into practice? So evidence-based practice research. So we need to find, what's our problem? What's our PICO question? What's our problem, our clinical problem? What trajectories, where do we want this to go? If it's a quality improvement, what pieces of that are problematic and how can we make that better? So when you look, raise the question, we get our PICO question, get our evidence, do our literature review, appraise that evidence, see what evidence best practices is currently being utilized at the bedside. Is there something that's not being utilized that should be utilized? And changing that so that we can affect best practice by affecting change. So our PICO question again, a population of interest, we need that. Intervention of interest, yes, we need that. Condition of interest, not necessarily required, but recommended. That's important to note. Outcome of interest and our time that we're doing that. So we need our question to be precise and appropriate to the problem that we've encountered. And then we need to go through the evidence-based process. We have models to use for that: Stetler, STAR, the Iowa Classic Model, the Johns Hopkins Nursing Evidence-Based Practice Models. There's many models that we can use that the institution will decide that we can use to assess evidence and make our practice, improve our practice. There are also, if you move to advanced practice, clinical practice guidelines, CPGs. Those are out there. Experts have developed those. What is the best practice related to topics like pain? And what is that really the best evidence that we have? Then we'll also look at research and evaluation. We'll use our librarians to help us with literature reviews, look at meta-analysis, systematic reviews, integrative reviews, what knowledge base is out there that helps guide us to where we need to go with our problem. Look at the levels of evidence, strength of evidence. Review chapters 1 through 3, especially those charts, flow sheets, figures about levels of evidence. That'll come back on this last exam. So we're coming full circle in how do we appraise the evidence? What are the levels of evidence? What is the strength of that evidence? And the quality of that evidence can be used for evidence-based practice and moving our knowledge forward and resolving problems that exist. So we look at with our articles, what's our sample, what's the sampling method, what's the population, what is our research design that was used, where was the study conducted, can we generalize that to our problem? When was it done? Is it old research? Is it current research? If things changed since that research was done, what is the questions that they've asked? How was the data collected? What was the validity, reliability of their tools, their outcomes, the statistical tests? Did they have control? If they're doing a quantitative study, was there a control? With qualitative study, how can we ensure rigor with that study? So we're critiquing the articles. We look at gaps and inconsistencies, look at other projects. We can even access databases about dissertations that folks have done for their PhD work and that are not published in the periodicals yet, or may not have been published at all because of the cost, and the process to get that done is becoming more and more cumbersome and really being a deterrent to getting new information out there. So we can look at dissertations in the database. We need to see what is collected. What do we need to be collected? What is irrelevant or can we leave off? Then we got to summarize our findings, make recommendations. How do we affect change to implement the outcome of our evidence-based practice? What is our best practice? And then look at the gaps, summarize the findings, make recommendations for changing the policy or procedure or our quality improvement. So these kind of almost say the same thing. And then we have our summary points. Like I said, this chapter is really short. There's no questions. You want to go back and review the first 3 chapters in regards to types of studies and the levels of evidence and how do we move our bench research, how do we look at our research reports, our research articles, and how can we interpret those and use those with our quality improvement issues, with our clinical problems to improve patient outcomes and to be using the best level evidence that we can to care for our patients. I'm just going to flip through the rest of these. You can look at those, read your chapter again in preparation for your exam. And this concludes the talk about evidence-based practice.